This video demonstrates successful completion of peripheral venous access. Perform hand hygiene with sanitizer at bedside. Identify patient with two indicators, name and date of birth, checking the EMR and the name band, verify order, and check for allergies. Hi, Ms. Smith. My name is Abby. I'm going to be your nurse today. We are going to be starting an IV in your arm. So if you could go ahead and give me your name and date of birth. Susan Smith, 7/24/69. And do you have any allergies? Nope. And I'm going to check the computer here to make sure you have no allergies. Gather supplies: angiocath, IV Start kit, extension tubing, saline flush, towel, alcohol preps, and gloves. Prepare supplies: cleanse extension tubing hub port with alcohol pad for 15 seconds and allow to dry for 15 seconds. Flush with normal saline syringe using sterile technique. Loosen the cap, but keep the cap on extension set that connects to catheter hub. Open IV kit. And open angiocath. Place clean towel under patient IV site. Palpate and select vein. Apply a tourniquet 3 to 4 inches above the venipuncture site with ends of tourniquet pointing away from the entry site. Don clean gloves. Cleanse IV insertion site with chlorhexidine using a back and forth motion for 15 to 30 seconds. Allow to dry for 15 to 30 seconds. Do not wipe or blot. Hold the skin taut against the vein using non-dominant hand without touching the prepared site. Hold catheter by the hub and dominant hand bevel side up at a 10 to 15 degree angle. Insert catheter using sterile technique directly over the vein or from the side. Assess for blood return and advanced catheter. Retract needle using safety apparatus at insertion site. Release tourniquet and apply slight pressure above insertion site while attaching extension tubing to catheter, maintaining extension tip sterility. Stabilize catheter. Aspirate slightly for blood return and flush gently with 3 to 10 milliliters of saline, observing the site for infiltration and leaking.
Then clamp extension tubing and remove flush syringe.
Place sterile, transparent dressing over venipuncture site, including only the catheter hub.
Loop the tubing near the entry site and anchor with tape. Anchor with additional tape if needed. Verbalize placing disinfecting cap on hub per hospital policy.
If this hospital policy was to put a sterile cap on the hub, I would do that at this time.
Remove gloves.
Perform hand hygiene. Label the IV dressing with date, time, and initials without writing on the patient. Discard needles, flushes, and trash into appropriate containers. Verbalize documentation of the IV insertion procedure, including site, catheter size, number of IV attempts, amount of saline flushed, and patient response.
I completed an IV start in the right upper arm with a 22 gauge needle. I had one attempt and flushed 4 mLs of saline, and the patient responded well.